Thank you for having me. I'm always nervous when I stand between you all and lunch, but I will try to get us out on time. So I decided to kind of do a different approach for my talk. I thought a lot about what I wanted to say, and I know you've had so many great presentations on the modeling side, so I kind of wanted to talk a little bit more about my approach towards research from this equity lens and kind of how I straddle the fences between research, advocacy, policy, and practice. So of course, I'm a researcher at Morgan State University. For those of you who don't know, that is located in Baltimore, Maryland. We are a historically Black college and university. But I also do a lot of work in the community of Baltimore, and fortunately for me at our university, that is something that is valued. So I have been able to still kind of be in this world between advocacy, policy, and research and make it through the tenure process through full professor. But some of the work that I'm doing, like I work very closely with our Transportation Alliance that focuses a lot on having quality transit for the city of Baltimore. In Baltimore, about 1/3 of residents don't have access to a car, so really focusing on good transit is really important to the city. I've been able to work closely with the city of Baltimore as well as some of the state agencies on crafting policies and directions for transportation. So for example, I led the mayor's transition team for transportation and infrastructure, which kind of set the agenda for the past 4 years. I've been able to work on complete streets legislation, which I'll talk a little bit about today, and serving on a transit restructuring task force. And then I am a PE. I do work closely with some consulting companies in practice. And really where I kind of lie is being that liaison between the community and the prime consultants, are really focusing on community engagement practices and stuff when working with private companies. So I thought a lot about the projects to talk about. I'm gonna talk about two kind of research projects and then one that's more on just the policy and implementation side, so you can kind of see how hopefully all these things come together to actually affect some sort of change in wherever you are working. So I know everybody talks about equity. There's so many definitions. You've probably gotten a different definition for every talk you've heard. Mine will probably be no different. So you see the B because equity is the buzzword of the moment. And one of the things I will challenge is making sure that we're doing authentic work in the equity field and not just because it's something that's currently being funded today. But what I'll be kind of talking about is kind of these three different types of equity. So when I do a lot of work with community engagement, that kind of falls on the procedural side of equity. So making sure that we have inclusive and authentic engagement, making sure that we're engaging those that are representative of the study area that we're looking at. And oftentimes this means bringing in additional funding, being very proactive about how you do your engagement, when you do your engagement, things like that. Distributional equity, I think, is what most people think about quite often, and that's looking at the distribution of benefits and burdens. Oftentimes it's done in a geographic manner with a lot of mapping and kind of location-based metrics. That's kind of the baseline that you'll see a lot of agencies do because it's low-hanging. And you can still get some good work out of it, but we have to be careful in how we define certain things. So one of the projects I'll talk about is looking at food deserts and food insecurity and looking at what we're mapping and what we're measuring and asking if it makes sense what we're measuring. And then the final one is what I hope we get more towards is the structural equity, where we're actually institutionalizing equity into the practices of those who are making the decisions, right? So that means through our programs and plans and policies, right, we're accounting for equity in this systematic way. And when thinking about structural equity, we're really kind of highlighting the fact that we're recognizing that our systems in the past have caused us to be inequitable. It wasn't chance, it was the policies and practices that were implemented previously is why we have these inequities now. And so now we're trying to correct those through this different policies and practices in those same institutions. So the three areas I'll be talking about, I debated about the schools because I saw we had some other talks about schools, but this one is one of those projects that's near and dear to me. It's actually one that was never funded. So this kind of comes more on like the advocacy side of things, where I've partnered with different organizations to look at school choice in transportation for Baltimore. The second one is looking at food insecurity and how people access grocery stores and fresh food. And then the last one is talking about legislation and work that I had been a part of. It's an ordinance that was passed in 2018 to provide a modal hierarchy for transportation. And I'll be talking about, despite the fact that it uses like the best practices in research and all these great things, the pushback that we're seeing now in the community, so the messier side of implementing equity in 50 minutes. Okay, so the high school part is kind of thinking about distributional equity as well as procedural equity. And so this is some older work. I first got into being interested about the impact of school transportation just before we had a major bus system redesign for the city of Baltimore. In Baltimore, middle school and high school students take public transit to get to school. We do not have yellow bus service. And what we found was really surprising. Like during the bus redesign, they weren't necessarily talking directly about students and the impact that this redesign was having on them, despite them being one of their major constituents. So this is just kind of an example of how we can use like our research tools towards advocacy. And so I like to start with framing. And this is actually a video that first got me interested in the work. And it's about 15 years old, but all the issues the students state are still the same today, pretty much. And so this just kind of talks a little bit about what they go through. Hopefully y'all can hear it.
I get up at 5.
6:30. 6 o'clock.
6:25.
5:45.
What time do you have to be to school?
8 o'clock.
And I go to 13, 8, and then I knew
The 27 to the light rail. Take the light rail from Tri Hill to North Avenue and catch the 13 up.
I get dressed, I wait a couple of minutes, and at 6:10 we go and stand on the bus and we wait for the 6:20 bus.
How long did it take you to get to school?
45 minutes to an hour.
45 minutes. Hour and a half.
Okay, so that's the problems. That's where, I was like, okay, this is a problem. This is interesting. And the reason why we kind of have this problem, so once you reach middle school in Baltimore, you can go to any school within the district. So it's an open choice school district, which on paper, makes a lot of sense because you're no longer being constrained by your location in terms of the type of school that you can access. It's also a more affordable model, right? Because you don't have to duplicate a lot of programs into multiple schools. However, you have to get to that school, right? And so for us, if you're getting to the school on public transportation, and depending on the program that you're interested in, you may have to crisscross across the city to reach that school of interest. And so this is just showing you, the picture on the left is the density of students across the city. So this picture is actually very similar to the racial demographic of the city too. We have this kind of term in Baltimore that's used all the time, which is the white L and the black butterfly. And racially, the mostly white, more affluent areas kind of in this central spine, and then to the east in the city, and then the outskirts, which they call the black butterfly, tends to be more mixed demographic, predominantly black parts of the city. So you can see where we have high concentrations of kids, but we also see that we have some schools, that are, in the areas where there's not a lot of students who reside there. The picture on the right is not a great picture, but the dark lines are our bus routes. And the most important thing to take note is that most of the routes are going in and out of downtown, which is located here, kind of right outside the harbor. So for a lot of the trips, you kind of have to go in and out of downtown. We have two rail lines. The metro is shown in blue, and the light rail line is shown in red. Once again, takes you in and out of downtown, which is where students don't really live. And so this creates this kind of spatial mismatch. And the size of the circles are the schools, and the size is how many seats they have or their enrollment at each of the schools. And so, once again, this is why we have those long commutes. And so the first thing we did was just kind of look at, based on the GTFS feed, the General Transit Specification feed, which is a way of standardizing transit schedules, we were able to kind of map from each school how far you could travel within, different 15-minute increments. And technically, if all schools were created equal, you could get to any school where you live within 30 minutes. You can get to a school within 30 minutes. However, not all schools are created equal, right? So in the middle, I'm showing the three CTE schools, which stands for Career and Technology programs. So these are schools that have like electrician mastery programs, automotive programs, those kind of real trade type schools. And you can see there's only 3 of them and where they're located. And yes, they are technically geographically dispersed across the city, but when you look at the transit network and travel times, you can see that for many areas where we actually see a lot of students, particularly the South Baltimore area, they require upwards of 90 minutes to get there. And more importantly, when we did these maps, we assumed 100% schedule adherence, which we all know is not true when it comes to transit. So if we actually took in reliability metrics and things, this would probably be even more magnified. And then the last one are like our highly selective schools, where these have academic entrance requirements. And if you note, they're in the center spine of the city, right? So the one at the bottom is the art school. That one's pretty easy to get to because it's where like a lot of the routes converge. But those 2 at the top are City and Poly. Poly is one of our STEM schools, and that one, people travel quite far distances and time-wise to get to.
Are these all public schools, or is it like public schools and then maybe some have like charter school type things, or maybe there's selective programs which are limited access? Or
these are all public.
They're all public.
Yep.
So even the highly selective ones?
Mm-hmm. Yep. So the other ones you just apply to, and it's like a lottery system. The selective ones, they have some other extra criteria, like the arts you have to actually audition for and things like that. So yeah, so you can see the nature of the problem there. And here we were just looking at where people are coming from. So I just pulled 2 schools. We had the home location and the school for every student, every high schooler in the district. The black markers where the school is located, and then you can see the dots are the residential location of the kids who are going to that school. So Poly is that one that's the STEM-focused school. And you can see that they're literally coming from all over the city because that is one of the best schools in the district. The color of the dots represents race. And so you can still kind of see that white L, black butterfly pattern there in terms of race. White are shown in blue, and black is in green. And then Patterson is one of those kind of choice lottery schools. They don't have any specialized programs necessarily. And that's shown on the right. And you can see here that students are more close to home, not necessarily like walking distance close, but often within like a direct bus line or a pretty easy commute. But you still also have some coming from further. This is actually off of the rail line, so their commute may not be too bad. But you can see that you're still pulling students from across the city, even in that choice only scenario.
I was interested in this situation as it is right now with the schools, right? Which school is what and what specialty? What was shaping the situation? Was it sort of really that people decided, let's do it this way? Or was it more like that it just happened, or was sort of like positive feedback loop? What led to the status quo?
That's a good question. I am not 100% sure. I know in terms of like the schools that have been good for decades. In terms of some of the specialized programs, I know there has been some shift over time as to where those programs are, but I mean, a lot of them are really expensive to implement, so once they're there, they're there. We actually had more so school closures and consolidation as opposed to restructuring.
But it's not what somebody high up said, we want this school to be that. It really sort of, in some sense, grew without people knowing exactly.
Yeah, sometimes more organic than intentional. Yeah.
On a positive note, maybe after seeing the presentation yesterday or 2 days ago, both schools have a diverse student population, which is positive, right?
Yes, I mean, the city is very diverse. Now, what we don't show, and in that map of why the residential density is so low in like certain places, like here, there's a lot of youth who live here, but they don't go to public schools. So those I'm not accounting for in this. So there are those uncounted kids, yeah. Okay, so we modeled what the best transit route was for every single student who lived more than 1.5 miles from their school. The reason why we chose 1.5 miles is because that's the threshold that gets you the transit pass from the school district. If you are closer to that, you are expected to walk. So we did that for those students. Once again, it's using the schedule. Based on the schedule, the average travel time was 36 minutes. Once again, you can factor in what it really is once you factor reliability. And just for comparison, we compared it to the ACS survey to look at what the average travel time was for adults who use public transit to get to work, even though that's usually more outside the city than the school, and they're comparable travel times. So we're asking youth, starting in middle school, as young as middle school, to do very complicated commutes. So I'm just showing high school, but middle schoolers are still doing the same thing in Baltimore. So we found that even based on the schedule, 1 in 4 students have commutes that are greater than 45 minutes. And we chose 45 minutes because that's what our city kind of uses for job accessibility and those type of metrics. That's the threshold that has been accepted in our region. We also found that over 60% of their trips require a transfer. So only about a third of their trips are direct to get to school. And what was interesting when we talked to a lot of the students about that, I mean, they really talked about how they decided which route to take. In Baltimore, you may not necessarily want to wait in certain neighborhoods for various reasons, and so they have to factor that into their travel and their patterns and commutes, which my model did not do that, right? It was just strictly based on travel time. But in reality, there's a lot more kind of more nuanced things that are going into their decision, which are things that ideally we may want to eventually be able to account for. And it turns out that 1 out of every 8 MTA, which is our transit agency, passenger trips are made by high school students. And this was pre-COVID. It may be higher percentage now. And despite that, when they were doing the bus redesign, there wasn't a lot of explicit communication about the impact to students. And so one of the things that we were able to do is kind of use the same process that we had for modeling the travel times for the proposed restructuring and see what the impact would be on students.
Was the restructuring done through a consultant that the MTA hired?
Yeah. And it was over a few years that it was done. It was a major restructuring in the end. I don't know if you would really consider it a major, but it was restructuring and a rebranding of the system. So what we did for this one, we didn't look at necessarily the origin and destination between a student and their school because we want it to be more generic because we don't know how people are choosing and what school they'll go to. So the way we did it was we looked at how many schools you could reach based on where you live. And so the left was the pre-restructuring, and then this one was the post. The post was a little bit different, but this was the design that they put out there as the near final design. And so you can see where you have the biggest gains. Like they did kind of reduce some of that of all the lines kind of converging into downtown. So there is this kind of spreading out here, but really where we have a lot of our students kind of more in the outskirts of the city, which is who had the worst access to begin with, we didn't see a lot of change. So based on where there were youth, we saw a 47% increase, or 47% of students had an increase in the number of schools that were accessible within 45 minutes by transit. 14% had no change, and 39% had worse or decrease in the number of schools. And so we didn't use this to tell the agency what to do, but we use this as a tool to just give to advocacy groups to be able to say, hey, can we get a meeting between the school district and the transit agency? Can we talk more about what this impact will be to students, what the messaging will be to students, and that sort of thing. So it was really kind of used to raise awareness about the importance of this impact.
47% of what? Of the zones or of the population?
So of the current high school students, so we looked at where they currently lived and did that. Mm-hmm.
Are the school bus system complete end to end, or should I think about them as one edge of a multimodal?
So it's a public transit. So it's just the general city service. So there's still the walk component. There's still all that, and that was included in our travel time. Was also the walk time. And we did some ground truthing, looking at the data that we had. So because of the passes, we knew when a student tapped onto the bus, when they, and then we looked at when they tapped on relative to the start of their school day. Now, when they tapped on doesn't mean they made it to school before the school day started. So that's, but we have no way of knowing when they got off the bus and so forth. But we could see in general for these kind of specialized schools, City and Poly are our top two schools. Most students are getting onto their first bus around an hour before the start of their school day. But then when you look at kind of those choice lottery schools, most of them are about 15 minutes before the start of their school day, so it's a lot shorter trip. We also started exploring absenteeism because we knew we had their data about absenteeism. We did some exploratory stuff. We did find a connection between how complicated your commute was and how many days absent you were. But that is definitely something for the modelers out there, an area that could use further study. And this was just one of those kind of Bayesian models that we had looked at. I didn't have those results on my laptop, so I couldn't provide the data. But since I know a lot of people in here are interested in more of the modeling aspects, I'm posing some questions that I think warrant further work. One is that relationship between your difficulty in your commute and absenteeism. The second is that the district is able to provide school trippers, and school trippers are supplemental transit service to help students get to school. There's a lot of legal constraints about how you schedule school trippers. They still have to be open to the public. They have to follow an existing route a certain % of the time. But there could be a lot of work in how to optimize where those school trippers are to kind of reduce the worst trips that students have to take.
Sorry, what is a school tripper? I never heard this word.
It's a supplemental bus service. And so it's basically the transit agency as an extra bus. A lot of times they allow that bus to go directly to the school instead of what the main route may do, but they still have to mostly follow an existing route. And that's part of it. There's some laws about competing with private companies that restrict how much transit agencies can do. But yeah, so there's could be some work on optimizing trippers. For those in the travel behavior and choice world, how do families factor in transportation when deciding on schools? I'm really interested in optimizing bell schedules to reduce crowding. Some of the things we heard with students was that the bus would just skip us because it was too crowded. But if you have all the schools starting around the same time in the same area, you're gonna have that issue. So some of that could be alleviated through smarter scheduling. And then also getting at the question we had posed before is, could we maybe plan where these programs are a little bit better in our school district? So that's that one. Question.
Clarification.
Mm-hmm.
The two slides before that, the percent absenteeism, is that 41%?
Yeah, so what we defined as chronically absent was you were absent 10% of the days. And that meant 41% of the students that attended that school.
So if these are the good schools with 40%, that seems
so that's bad. So you can see the more selective schools is much lower, still not, but City and Poly are the two top schools. So you can see that's kind of the good end.
What fraction of students go to school by transit? Do you have
The majority. It's transit, some walk, some who are lucky, their parents will drop them off.
Yeah. So what's roughly?
I don't have a number offhand. When we were looking, it seemed like it was probably upwards of like 75%. It's still the majority, yeah.
Okay. Thank you.
I mean, in the city, 1/3 of households don't own a car, so those families don't even have the option of taking their kids to school. And then many other households have one car that's being shared amongst multiple adults as well. All right, so the second topic was looking at food insecurity. Most people call it food deserts. The more kind of accepted term now is food insecurity areas or food insecure areas. And this one was just kind of looking at how we measure this spatial equity in a way. And so this actually came to me from one of my students who was talking about some of the stuff they were looking at for a paper. And he was doing it for a GIS class and was like, why do all these food desert measures show different areas as being food insecure? Like, how did they come up with that? And I was like, that's an excellent question. I don't know. But what we knew is most of them were based on some sort of income threshold, the distance you are to the nearest supermarket, and a threshold on vehicle ownership for the area. And so I'm going to show two kind of the USDA's definitions, which they have 3, and the locally accepted one in Baltimore City. And so here you can see USDA, they have kind of 2 different ones. One is based on low income and low access, and then a second one is just based on vehicle access. And so they use a threshold of either 20% of the median income or 80% of the statewide median. Sorry, the 20% was the metropolitan median income. And then they also look at where you are relative to the nearest supermarket. And they have 2 definitions. One looks at half a mile from the nearest supermarket. One looks at a mile. And so you can see for the half a mile, which is shown in orange, a lot of the city is deemed a food desert. And they're using census tracts, which are a very large geographic unit. And then there's some that are only, the green are those that are only at the 1 mile. They're at the 1 mile, but not the half mile threshold. And they also have one that's just based on vehicle access, which is looking at the number of households that don't have access to a vehicle and also live more than half a mile from a supermarket. And so that half a mile is kind of like that walking distance threshold. Baltimore City does something a little bit different. One of the interesting things is they include a healthy food availability index where they went out and they surveyed pretty much all the grocery stores, a lot of like the corner stores in the area, and created this average like metric for what the food availability is in the area. And they also have used income, vehicle availability, and distance to the supermarket, where they shorten that to a 1/4 mile. And then you can see they also only consider residential areas, so it's a little bit more segmented than the USDA. And then this one is just showing you the black areas is the cities one versus the 3 USDA ones. You can see how different of areas they're indicating. Mm-hmm.
This is so interesting to me and also new. So, I mean, I don't mean to ask you to be inside the head of like the policymakers who are deciding these things, but for me, from like more of a just data science background, like I would think like, oh, we have a bunch of geographic units and these are the things that I think are indicative of food insecurity, and I should just like characterize each unit by these 4 numbers or whatever. And
so
like,
more of a score?
Look for, well, no, like even just these 4 different numbers.
Mm-hmm.
And like think of it as some kind of more higher dimensional like data problem and just like look for patterns. Like, oh, there's like these census block groups that are, you know, high on this thing and low on these other things, and these other ones. So like, how should it seems there's a desire to have like a binary classification. Like we want to say a particular unit is food insecure or not, But that also, and so I understand why that's useful, I guess, but it also seems like really limiting to me.
I
It
agree.
seems like you're like throwing away a lot of nuance.
I agree.
Yeah.
Hold your question.
Okay, yeah.
Because it may. I was thinking about it too. So what we did, and it may answer, if I don't, come back to me. So we surveyed a bunch of residents. We did half online and then half we actually went to the grocery store, and we had gift cards for that particular grocery store. So we partnered with the grocery store by saying we'll buy their gift cards. They suddenly were very willing to allow us to stand outside because they were just spending it as soon as they went into the store. So we gave them grocery store gift cards to take our survey at the grocery store. And we distributed it across the city. And we also looked at different types of stores, so like more like affordable versus a little bit more high-end in terms of the types of stores that we looked at. Not talking about this here, we also interviewed hack drivers. So hacks in Baltimore are basically Ubers and Lyfts before we had the app. In Baltimore, you can stand on the side of the road and do signals to indicate that you need a ride, and people will stop and you pay them to take you where you need to go. A big part of hacks is to supplement getting to and from the grocery store, because taking transit is just not really feasible. And it was really interesting because we learned that they really get to know their customer. They will sometimes like take the elderly person's bags into their house. So it's a little bit more of a personal service than what you see with like an Uber or a Lyft. So we did this survey. For what I'm showing today, we needed to know the store that they were shopping at as well as where they lived. And so in the end, we had about 400 usable surveys that were both in the geographic area we wanted to look at and had all the data. And so what I really wanted to highlight here was most people didn't shop at the nearest store, right? So if we're doing all of our metrics based on do you shop where you are relative to the nearest store, is that really being equitable? Just because this grocery store is next to me does not mean that's where I want to shop or where I can shop, right? And so having your metric being based solely on that location is not allowing those to have the same choices that those who are more resourced have, right? And so we looked at the different types of grocery stores they were shopping at. So USDA pretty much only considers like supermarkets, and they can be specialty grocery stores, but they don't consider like Walmart supermarkets or Costco's or anything where you need to have a membership. But we did see that people were shopping at those stores, and this was just a map by how many people were shopping at the stores. Even though we were only focused on Baltimore City residents, we did consider grocery stores outside of the city, of course, because you're not constrained by geographic boundaries when you shop. And this is just the names of some of those stores. So, you know, some are more high-end than others. But you can see, you know, like the Save-A-Lot where we looked at and some other places. We looked at the mode that people take. We were interested in that because the metrics pretty much only considered walking and driving. And that seemed valid from what we heard. Those who did not own a car, some did use transit as their primary mode, about a quarter of those who did not own a car. But really, a lot of people relied either on walking to get to the store or paying or getting a friend to take you to the grocery store. And we did look at it by going to and from the store, but this is just in aggregate. And so we were really interested in how do we measure like your ability to assess to access a grocery store. And so we looked at these various things like frequency of visits, the number of different grocery stores. Like I shop at like 3 different grocery stores on, you know, in a given month. So your ability to, you know, shop at multiple stores, and then store quality. And then we did also kind of dive into the nearest grocery store. So I know I'm getting close on time, and I want to make sure I do the legislation part. So I'm gonna show a couple of them just to show the method that we used to establish our new metric. And we did look at those kind of 3 things that all the metrics were using, which was income, vehicle ownership, and distance to the store. So what we did is we, based on our survey data, we did some decision tree analysis to see if we could determine which of those predictors factored into, you know, the frequency of shopping, the number of different stores you shop at in a given month, and the the last one as well. So the first model was just taking the most common variables that are being used. The second one, we're like, well, are there other socioeconomic variables like education, household size, employment status? And then the third one was looking at the number of stores available to you. And we did that with different thresholds, such as a quarter mile, half mile, 1 mile, and 3 miles of your residence. And 3 miles was kind of used because in our survey, most people never travel more than 20 minutes to access a grocery store. And so I'm going to actually just kind of dive to the decision trees for the sake of time. So this one is, do you shop at the store that's closest to you, yes or no? And for this, what we found was, unless you're within like walking distance of a grocery store, which is that half-mile threshold, you were not necessarily shopping at the closest store. So as soon as you had to use a vehicle, it was free game where you shop, right? And so, so it is important. And so thinking about like the USDA measures, like the half-mile probably makes more sense than the 1 mile threshold. That's what we saw that was more significant. But beyond that, you know, distance didn't really play as much of a part. And then the other thing we did is we took where all our survey respondents were, and then we classified them if you were in a food desert or not based on each of the metrics to see if there was anything that was statistically different being in those two categories. And when it comes to shopping at the nearest store, only the USDA metric that was about income and access was there significant differences between those who lived inside and outside of a food insecure area. Frequency of grocery store visits. This was just looking at the average number of visits per month, and naturally having a vehicle, you were able to shop more often. There were some interesting things about income, or those in the real high earning shopped a lot more often than those who did not. And then when we looked at the models, regardless of if we included the extra socioeconomic variables and so forth, only income was significant. And so, you know, a lot of the models use both income and vehicle access, but we all know that they're highly correlated. And what we found was income typically always trumped vehicle ownership. And it makes sense. From a lot of our conversations, people were talking about how they basically have these budgets, right? And you're budgeting spending your grocery money on transportation, you're budgeting spending it on groceries, and so that all kind of factors into play into how you make those decisions. So it turned out that income was a little bit more of an important predictor than vehicle ownership.
What year was this survey done?
This was done pre-COVID.
Okay.
I assume that was, yeah, it was just before COVID. Mm-hmm.
Just a short question. When you say grocery visits by car ownership, does this necessarily mean that everybody who has a car? Do you count people who have a car and are at the grocery? Or do you count people who go by car to the grocery? Or is it just the same?
Good question. Your household has a car, not what mode you took. Meaning,
so in Europe, it could be quite a difference. So I have a car, but I usually go my grocery things by foot or by bike. So I mean,
yeah, no, Baltimore, most people aren't doing that. So yeah, but it was just if your household owns a car. But that's important, though. I think context is very important. Yeah. And none of the grocery metrics that we looked at showed any significance with frequency of shopping and the metric. And then the number of different grocery stores that they visited per month. Income, once again, was the only thing important, where that threshold was at the 35,000 mark for the city. So kind of those who were at or below 35K for household income shopped about 2.3 different grocery stores per month. Those above that were a little bit closer to 3 at 2.8 stores per month. And nothing was significant for that too. And then the most important thing really is quality of food. You can see, as expected, when income goes up, the store you shop at has a higher quality of food. And once again, income was the only predictor, where really, really low income at like below 20K, we saw really much lower kind of quality of food. And then kind of above and below 75K, there was another difference. So kind of like those really high-end stores versus like the regular stores that people shop at. And so what we wanted to do was kind of using this information, think about what we would want to show as a food insecurity measure. And so what we decided was really income is more important than vehicle ownership is what we saw. So we did nothing in terms of vehicle access for that area. And so we just showed areas that had an income less than 35K. We chose that, depending on what we were looking at, the threshold shifted a little bit, but 35K kind of popped up in multiple of those metrics. And then, of course, we only looked at residential land use, so we kind of ignored the parts of the city where people aren't living. And then we wanted to, once we say, okay, these are the areas, maybe try to prioritize them a bit. And so we prioritize them based on the number of stores that you had access to within 3 miles. And those cutoffs were part of another model that we had looked at in terms of the frequency of shopping. And if you had a store within a half a mile, meaning that you had the ability to walk to at least one grocery store. And so really the outskirts are the areas that are the worst because they don't have access to a lot of stores, and they don't have stores that they can really walk to just with the nature of the land use in the area. And so we met with the planning department and presented our results to them, and they were very interested in it. And I did the same analysis with our metric, and it turned out that frequency of visits and the average quality of the food were significant with that new metric. And then this is just kind of comparing ours to what the city uses. So it's very similar. It's in alignment, but there are some kind of new areas that kind of rose up that weren't in the city's measure. And then just kind of in conclusion, once we met with the city, we actually started meeting with them during the survey design phase, which was very helpful because we were able to incorporate questions that they were interested in. They wanted to talk about what to do, and they've been doing a lot of different programs. And one of the things that they were wanting to pilot was, can we do a program that we transport people to food? And so we had this partnership with Lyft. This here is just showing why grocery stores don't necessarily come to lower income areas. Even though lower earners may spend a bigger percentage of their budget on shopping, the overall average amount spent per year is much lower. So to kind of balance that out, you need to almost have like twice as many lower income shoppers to get the same revenues as a higher income area. So it's really hard basically to encourage stores to move into the area without incentivizing them. So they wanted to think about transportation because it was a quicker solution.
I was just wondering, so I guess all of this was done kind of prior-ish to like grocery delivery services, which
Well, we did ask on the survey about grocery delivery. We found that most people that we had talked to use food delivery, like fast food delivery, but not grocery delivery.
I feel like COVID at least I saw a huge uptake in people using food, and I wondered if that could speak to this problem. I would assume higher earners tend to use grocery delivery, and if that would translate to them not necessarily caring that stores are as local anymore.
Yeah, so they have started piloting that. So one of the things that the city has is we're a pilot, or the state, online SNAP, and SNAP is a food benefit program from the government. Initially, you actually were not allowed to use SNAP for online purchases. So the federal government just allowed some states to pilot that, and Maryland is one of those states that can pilot online SNAP. The thing is, sometimes the costs are a little higher online, and then the delivery fees. So they were thinking about maybe subsidizing like the delivery costs instead of transportation costs. But we did some focus groups, and people were like, well, I like to touch my food. I like to really pick it out. So it was kind of mixed. And it was also generational too, had different feedback as well. So basically I just wanted to kind of highlight how by establishing this relationship, I was able to kind of work with them when they established the pilot. And the thing that was helpful, I think, I joined a little late after they already had the agreement with Lyft, but we were able to at least request data that was more usable from a research point of view. So like initially the Lyft was providing data at the census tract level, like these are the number of trips from this track to this track. Well, like we knew a unique identifier, but we didn't know exactly where people live. The closest we could get to was a census tract. Can't do much with that. And then they would do like our time. When I first joined them, they gave them like I think maybe it was 4-hour windows of time as opposed to like disaggregating the time. So we were able to help kind of like amend the contract. So I think that's one of those places where researchers can kind of come in is thinking about, okay, if you're gonna do these contracts with these private companies, what information as a city can you mandate, because you have the power to do so, that they report to you so that then your local researchers can use that in a way that's effective. So that's what I wanted to kind of highlight from that. And then lastly, I'm gonna skip through that, is the legislation, because I think this is the really interesting part of being able to kind of help craft legislation and see the impacts of it. So we have a complete streets ordinance. Some people believe complete streets is a complete failure in the city. And so this is looking at kind of that operationalizing equity and how you can try. It may not mean everybody is happy, but this is a very solid attempt, and we got some national awards about at least having the kind of foresight to do something like this. And so what the ordinance is, it's basically providing a guidance on how to design your streets. And I'm gonna play this clip because I know a lot of people aren't from transportation, and so saying a complete street probably means nothing. So this kind of explains it, and this is the information video that the city put out.
Baltimore's new Complete Streets Manual is a resource to help make better decisions about how changes to our streets happen. It promotes safety and equity by giving highest priority to the most vulnerable street users amongst us. It does this by considering all the ways people get around our city and prioritizes making it safer, easier, and more enjoyable to walk, take the bus, or ride a scooter. So what does this mean for you? It means the new design features that make it easier and safer for you to cross the street, letting you better connect with your neighborhood or with your destination. It means curb space can be better managed to make it easier to drop off or pick people up, create space for deliveries, and provide room for a nicer sidewalk experience which benefits businesses around the community. And it means that most of the car-oriented streets can be made safer and more welcoming to you, however you choose to get around. Check out the Baltimore Complete Streets Manual online at this address.
Now, that's the video. Now, what people see is you took away my parking. You reduced my travel lane, right? So, in theory, we would think it's a win-win, but a lot of people will have pushback, yes.
But I think the complete streets are a complete failure argument is a different one than from that populist one.
It is, but that's how they're framing. That's how.
But could you specify also that other argument, which, as far as I understand it, but I don't really understand it, it's an equity argument against complete streets, right?
It's an equity argument. It's a safety argument. Are the two big ones. A lot of stuff with complete streets is like traffic calming.
So let me ask you, what is a complete street?
So it basically is a street that's being designed for all modes of transportation, as opposed to just prioritizing cars. And the idea behind it is that, you think about, first you prioritize your most vulnerable roadway user, which would be the pedestrian. All trips start and end with the walk component. So you do things like slowing down traffic by narrowing lanes, putting like curb bump outs to make you turn at a slower speed. So through design, you're making people drive safer. And often that means slowing you down and doing things like that. Or maybe sometimes taking away a little bit of parking so that you have a clear line of sight when you're crossing the street. So we prioritize pedestrians first. Then second is like the cyclist, the transit user, the micromobility user. Honestly, where most of the pushback is about cycling in the city. So they're complaining about complete streets, but really what most people are complaining about is cycling. And cycling has been very divisive in the city. And for many reasons. It's new. It was initially started kind of in the more affluent parts of the city. And it's kind of seen as a mode used by outsiders and newcomers into the city. mostly more white users, though plenty of people of color do bike in the city too, but it's a very polarizing subject. And they, in particular, just feel that they weren't being engaged in this process. It's not good. Okay, did this not record? Anyways, well, basically what they're saying was, you can see the quote here. No one disagrees that transportation, whether by foot or bike or car, should be safe. But how the government transforms spaces, places, and the environment requires a process that is open, objective, collaborative, equitable, and results in decisions that do not perpetuate structural and systematic racism and divides. So most of the complaints are about the process and how it was done. And so we just last week had a city council meeting about complete streets and if it should be repealed. And so last slide, just what to leave you with. First, the image is our Highway to Nowhere, a highway project that got canceled mid-build after about 20,000 people were already displaced. What I found is that my most successful projects are those that are kind of created from the bottom up, that I've kind of co-created with partners, whether it be community members, government agencies, and so forth, because then they care about the results. You gotta recognize both the history and the lived experience. So like in the case of that complete streets, like we know by research it all makes sense, but if you account for history and lived experience, it's a little bit more nuanced than that. You gotta establish trust with the community. For me, sometimes this means saying no. So one example is like Bike More, our bike advocacy group. They've been trying to diversify their board. I've been asked to be a board member, but I can't because I would do a lot of work with the community, and I know that they're a very polarizing group, and so I want to make sure that I maintain my community connections. Disseminate results in multiple formats and for multiple audiences, and then be careful about how you craft your research questions to make sure it's not, increasing inequities. And then the last thing is just practice equity in how you go about conducting your research. If you're engaging with the community, think about why they should give you their time. Are you compensating them for their time? Are you engaging with them authentically? Is it just, this is what we're doing? Are you really caring about what they're saying? They are the experts in their neighborhood. They know it better than you unless you live there yourself. Thinking about who may not be counted in your study, who you're partnering with, and why you're doing this work. So that's what I have for you.